Catherine Imurugit, KTN.
Thank you, Muragat, for that. Now, let's dive into a conversation. As I earlier mentioned, we are having a conversation on the strikes that are being witnessed in the healthcare sector. And of course, on the other hand, we are seeing clinical officers, their strikes is on day 2, while the nurses have halted the strike for 21 days, giving the Ministry of Health just some time to address those issues. And that's what we want to delve into. As I'd mentioned, George Gibore, my immediate left, who's the Secretary General, Kenya Union of Clinical Officers, and next to him is Seth Panyako, Secretary General, Kenya National Union of Nurses. But before we get to this conversation, let's just listen to what transpired yesterday.
Issues that we are highlighting are historical in nature. There's no one who can understand, for instance, why should we negotiate a CBA for close to 7 years? And yet a CBA has a life cycle of just 4 years. So meaning we are completing 2 cycles without a CBA.
We want to confirm that indeed these resolutions will be implemented with immediate effect. And starting this afternoon, we are going to call on the Council of Clinical Officers to report to the Ministry of Headquarters through their Chief Officer so that we can start engaging with the DHA.
Social Health Authority shall empanel and contract facilities and practitioners pursuant to Section 33(2) as read with Section 31(3) of the Social Health Insurance Act and regulations.
Agreed in principle, both Council of Governors, who represents over 95% of facilities in Kenya, that we will enable these clinical officers to be able to access the services directly.
All right, Gibore, I'll start with you. Following that, governors and the Ministry of Health just saying, we're going to address your issues. So then, is the strike still on?
Yes, Ashley, thank you very much for at least highlighting the issues which are very key and at the core of healthcare delivery. And one thing I appreciate is that both the Minister of Health and the Council of Governors admitted that there are issues that we raised on our strike notice that warrant to be addressed. Mm-hmm. And unfortunately, we always wonder why they take that long, because like the issues of the Social Health Authority is an issue that we started immediately after the transition. So since October, we tried to use diplomatic approach, and no one was listening to us. And that's why we wonder how insensible some of the government officers can be, to the extent that we have to stop working for them to listen to us. Mm. We have heard and we listened to them yesterday when they were actually pleading to us, or rather asking us that we give them some time. And we must say why we are where we are. Mm-hmm. It's because there are issues that we raise every time, every year. We come on the table, we negotiate, sign agreement. When we agree and go back to work, the agreement are left to gather dust without anyone to address them. Now, with these issues that they are talking about, the Social Health Authority is a matter of law, because clinical officers exist and are established in an act of parliament. We have been in this country since 1928, practicing with a lot of integrity, and the Kenyan appreciate the work that we do. But all of a sudden, after the change from the Social Health Authority, from the NHF to Social Health Authority, someone decided not to do what the law provides for self-regulation, and they directed that clinical officers, facilities that are registered under COC Act of Parliament, must go through a certain other entity which is favorable to them in the name of KMPDC. And that's what clinical officers said. We will not be their conduit to break the law, because that's not what the law says. And also directed that all clinical officers, and specifically the specialists, whenever they are doing any intervention or doing any procedure, they have to use a registration number of a medical officer. And then the system will never actually acknowledge the work I do. So whenever you are doing the data, is to mean that clinical officers don't work. someone who is never even at work will be seen to be working. And you wonder why such a ill motive, because this is a professional that is existing in an act of parliament recognized in this country. And we have a total number of close to 30,000, both in private and the public sector. So if you want to bury all those people, at whose interest? But again, why are you limiting services? Because when you tell me to use someone's number, you are actually limiting services and delaying access, service intervention. And therefore, whenever they are actually asking us to give them time, we have to assess whether indeed what they promised has been undertaken. And it's good to say today we have had a meeting with the PS Harry Kimtai. I had a meeting with him early in the morning, and he actually shown me, or rather assured me that they have taken the initiative, to implement the agreement that we did on 14th and whatever they communicated yesterday. But of course we believe that if they did so after 14th, we will not be on strike. Because when we agreed on 14th with the Council of Governors and the representative of the ministry was there, the next day the CS was on media, and also the Director General, Dr. Amoth, and the CEO, Social Health Authority, where the CEO Social Health Authority directly rubbished the agreement, directing the restating the same issue. So we felt like the agreement was not a good thing to them, that will have actually averted the strike, because we had not started the strike.
Okay. And that's not the only issue, the issue of SHA and empanelment. Yes. And we'll be talking about the other issues. But let's just get to Panyako. I mean, you have temporarily halted your strike for 21 days to address the issues affecting those employed under UHC. But that wasn't your only issue, wasn't it? Talk to us about the other issues that you're fighting for.
Yeah, we had different issues handled at different levels of government. The issue of UHC and nurse anesthetist and empanelment for nursing facilities registered by the Nursing Council of Kenya are substantively issues of the national government. The other issues cut across, and they affect different counties, like the issue of promotions are specifically to specific employer within the government. The issue of not negotiating CPA is specific, because like for the nurses union, we have a CPA with the national government. We have a CPAs with all state corporations. That's Moi Teaching and Referral Hospital, Kenyatta National Hospital, Kenyatta University Teaching and Referral Hospital. We are about to complete. And so we agreed as the National Advisory Council that we cannot call a nationwide strike because issues are different. Yes, there are those that cut across. But for example, an issue of increment of salary for second phase, you know, we had salary increment when the new government came in place. And these taxes came, and we talked to the president, and he said he's going to increase some salary to the civil servants. And 8% was increased. So first phase was done. Second phase was to be done from July last year. So when it was not done, some counties went ahead and implemented, like Kericho and Kisumu. So when you tell somebody we want to go on strike because that salary has not been increased, and you ask Kisumu to go on strike because of that, you will be doing a disservice to the people of Kisumu. But there were other issues that cut across the board, like promotions, like that non-implementation of that salary, non-implementation of the reduced grading scales from 21 scales to 17. And then, of course, we had like non-implementation of the return to work formula of 2017. Among other things that we raised at different county levels, had different issues. The issue of contractual employment. We have contractual employment by the county governments, and we have the contractual employment by the national government, which is the UHC staff. I've also come to learn that we have another group called Global Fund, who have not earned salary for the last seven months. And
where do they fall, county or national government?
They are national.
Okay.
And when we held a meeting with the government, the Minister of Health on 13th, they say they are putting every measure in place to ensure that the Global Fund health workers are paid. We were not aware, because if you don't come to us, we are not be able to know. The UHC staff are with us and they work with us, and some of them, they have joined the union. So we know they exist. But if you don't come to us and you don't join the union, we don't get to know what you're going through. Okay. So we have a group of workers that have very serious problems for 7 months, they have not earned. And from the meeting we had, we believe their money for salary is being processed, but they are also supposed to be converted to permanent and pensionable.
Okay.
As you can see, with the new regime where the global fund used to come from, you see now the brakes are being put there. So each country must now learn to live on our own in the meantime.
Okay. In those 21 days, do you have faith that your issues will be addressed?
You know, we gave a strike notice of 7 days. And the ministry referred us to even clinical officers and the doctors. And they told us, you see, the doctors gave us 21 days and we resolved their issues. You are giving us 7 days. How do you expect us to solve our issues? And then they said, in our recognition agreement, we put their clause saying that we will give a strike notice of 21 days. So automatically 7 days was going out of, though it's legal, because the law says you give a minimum of 7 days. But in our recognition agreement, we say 21 days.
Okay.
So they said within 21 days, we have every reason to believe that the government is going to resolve the issue of UHC by getting money from the National Treasury, 3.5 billion, to have them absorbed. And the reason why we had some kind of trust was that there were two issues. We raised two issues in that strike notice. The issue of empanelment and the issue of pre-authorization. When we were in that meeting, we were told the issue of pre-authorization and empanelment has been resolved.
Okay.
And I made a phone call to one of the nurse anesthetists, and the nurse told me, now we are able to go through. So it means now, for the nurses, from last week, I'm afraid, I don't know why clinical officers are not going through, but for nurses from last week, if you're a nurse anesthetist and you attend to a patient and you fill that form, it is going through. So it's known we have done that work.
Okay.
So we realized that now if that has been done, pursuant to our short notice we had given, let us allow them for the next 14 days, because from 13th we'll go up to on 4th. And if our members have suffered for 5 years, I don't see any reason why they should not be patient for only 21 days. Then we go out there to say we are not going to allow this to continue anymore. Okay. And I've said it would be upon myself. I will lead these people to go to Afi House to demand their rights. Yeah.
Okay. He said 5 years. You are on record saying, these issues are historical issues.
Yes.
Do you think there's goodwill from the government to actually sort these issues?
Yeah, I think that's where the rubber meets the road. Because one thing is that we have a government officer who have mastered the act of reacting to issues whenever you raise them. But all of a sudden, again, they go in slumber where they don't even remember what is supposed to be done. And we feel that it's because they don't have priority in terms of what they want to do. Like you see the issues we are raising about the Social Health Authority, I still go back there, is because there is clear law. So when you become the CS, actually, you'll swear to protect the law and to implement it the way it is. So when we realize that you are actually violating the same law and you are inviting us to support you, I think every Kenyan should stand against that. And that's what we are doing. And that is why we call it economical sabotage, because if you deny facilities that were offering services, some of them are private, they are offering services under NHF, and then during transition you just decide to exclude them without any explanation, no communication. You redirect them to go through another entity to double register. So that's economical sabotage and extortion, where you are more of institutionalizing corruption. And on the issue, the second issue which we raised on our strike notice was on the return to work of 2014, where we had a strike of 100 day with them, and then we signed a return to work with the Council of Governors, and also 120 days with the Ministry of Health. So we filed this return to work with the court, meaning the court adopted it as a court order. We expected that all the items with the timeline, they were to be implemented as they are. But again, as I said, no one is acting. So we are left with no option, because you write to them, they don't respond, they don't prioritize your issues, but they expect that you continue to be comfortable working. Now, the first issue of the CBA that I talked about taking 7 years, remember, the issues of about CBA are supposed to be renewed from time to time. It's not only in Kenya that we talk about 4 years. It's supposed to be annual, so that you take all the other aspect of issues that inform economic development in a country, so that then you don't expose the workers. Like the time of COVID, when it came in, you saw the President Uhuru had to give some relief to the workers. So some of them who were continuing with the work, and some of them who went home. And you see, some of these issues, if you go to international charter, the standard of practice for workers, you are supposed to ensure that they are not exposed. Because these are the tool of growth of any country. They are the people who propel growth in any country. So any time that you mistreat them and you don't take their issues with the utmost seriousness that it deserves, you cause acrimony, like what we are now witnessing in our country. Every time there is a strike, every year there is a strike, and no one tends to be thinking, how do we avert this, so that then Kenyan continue of having services. If today you take, for instance, a survey of facilities that are closed, even if there are 2, there is a Kenyan who have missed services, and that is a disservice. Probably they will go back and sleep, and yet they are pushing themselves to complication and even to death. The government should not celebrate such a thing. That's why we say that CBA are supposed to be renewed willingly, as because we have given ourselves laws and policies that govern on how to negotiate a CBA. Give the people CBA. I know that my brother is leading a union that was registered before me. It is devastating that still they are still pushing for the same, and the county government and the national government still scavenging on the same issue, instead of following what they have laid down as the law, because all the law belongs to the government. It is them who need to lead in the implementation, then all Kenyan follow. So, and that's why we are saying, when we agreed, I must appreciate that the national government, under the leadership of Mary Modoni, who was leading this, we have agreed on the CBA, and it has been forwarded for consideration in the SRC. We believe that then they can approve that. But of great interest is this issue of a short-term contract, which are punitive. I give a good example of my people who are receiving 50,000 for the UHC. Remember, these are people that we employed during COVID time. They actually saved this country when everyone was running away. All of us, we were at home. They gave themselves to serve this country. And actually, they were promised to be transitioned to permanent and pensionable, so that then they can be paid terms that are in tandem with the market rate. Unfortunately, with this government, and I know that the current president also promised that he was to do the same, but unfortunately, that priority, I don't know where it went. We are saying last year we agreed that actually when their term came to an end, we pushed that they put them on permanent and pensionable, so that then they can benefit from the benefit of that permanency, where they are able even to access loans and to grow professionally, because currently they cannot be allowed for 6 years. They cannot be allowed to go back to school. They cannot grow their professional. They are not able to expand. They are not able to do anything. Actually, they are static. But unfortunately, their money is taxable fully. So when you tax 50,000, they take home less than 20,000. Around 30,000, 32. So we are insisting that the government must prioritize this issue, including the global fund people that he has talked about. Those are people that we captured on our strike notice then, because it was still an issue. When you see a government allowing an officer working for a period of 7 years without pay, and they expect that person to wake up early in the morning, they will come and work for 10 hours, go back and feed their family. Really, why are we pushing our people? And this is why people are killing themselves, because they cannot afford to pay. Some of them, they are in Nairobi, but they come from maybe Bungoma or even Turkana. They are here, they pay their rents, they have to buy every food, everything, commuting, you have to pay. Where do they get money?
They have their allowances, ideally.
Yes, where do you get money from?
Okay.
So that's why we feel there is a lot of insensitivity in the government, and when we come out, it's not because we like going on strike, because we have been pushed. The government go on strike by not doing what they're supposed to be doing, and then we come there to say, no, you should stop this, so that we join them there to put some sense into them.
Okay, Panyako, coming to you. I mean, you said they've waited for 5 years. 21 days is not much when you look at that period and compare. But then, if you look at the bigger picture, why is it that there's little to show for it in terms of all the strikes? I mean, Gibore said since 2013, the onset of devolution, I think they've had 100 strikes. I don't know about your case, but why do you think there's little to show for it? Year in, year out, we're seeing those strikes.
We ran one of the longest strike in the history of health system in the world. We were out for 5 months, 100 and around 61 days. And that is when we came out with the nursing service allowance and the small increase on the risk allowance, of course, with other small things here and there. We cannot say that those strikes have totally been in vain. They have given us certain strides in our struggle to improve the welfare of our members. For example, the ongoing strikes today by county, I think they are the most successful strikes that have ever happened in this union. Because from where I sit, you see the county governments now, serious commitment. Some now are saying every financial year they are going to employ this number of nurses. Within this period of time, we are going to employ immediately this number of nurses. It has happened across all the counties that have so far signed return to work formulas, and they have committed themselves to complete the collective bargaining agreement within none of them over 60 days. So for the first time, I think this industrial action, we are doing things in a different way, not the way we used to do in the past. We may look like our strikes are going on, we are not on the street, moving a lot, doing a lot in the media, but what is important for us is for us to address issues that are affecting our members. So it will not be very accurate to say we have not succeeded in a way. We have, but the pace at which these results have been forthcoming are very slow, and they are laced with ignorance and insensitivity from those responsible for managing the affairs of health sector in this country.
How can we hasten that pace once and for all,
For example, you cannot tell me that Kenya does not have 3.5 billion shillings to add on 4.2 billion which they have to convert this UHC staff into permanent and finishable. We know that that money is available. You look like something like what's the problem? The problem is in the management of healthcare system in Kenya. When you go like in Afya House, you find all the directorates are headed by one cadre. So when they go to a meeting to discuss health sector, they actually discuss doctors. They don't discuss health sector. Even the head of nursing services, the director of nursing services in Afya House today is a doctor. When you go to the director of human resources, is a doctor. The director of public health is a doctor. So when they sit there, they look everything in that perspective.
Okay.
And so some areas are neglected and left out.
To become a club of doctors.
So there's need to diversify.
Yes, there's no diversity, there's no looking at the health sector as a whole, because when you sit in a diverse, a meeting that's supposed to be having diversity, and then you sit one group, you favor yourself. Even in our constitution, we say there should be diversity. Regional balancing, in this case, there should be professional balancing. So that is one of the main problems that we have in Afya House. If that disease is cured in Afya House, then we are going to have health sector back on track. Now, if you have problems in the health sector, who has killed it? It's probably not us, because we are not managing it. We are not making decisions. But when you go all over the world, key people in the health sector must sit on the table and make decisions on the direction where health is supposed to go. What I urge the government, the two levels, is that they become serious. When you know very well that that dispensary has one nurse, for example, and when that nurse is sick, who works there? Well, if she's a lady, she goes for maternity, it's closed. Over the weekend, it's closed because she cannot work 24 hours, 7 days a week. And you know that your people call them. So we must take responsibility as leaders. I'm saying this because, you know, this government I have a stake because it's me who put it in place. And sometimes when I'm confronted with questions, even nurses ask me, we thought you are in government. You are going to assist us. But when I went to government, I was immediately sent away because I had finished my business of putting government in place. So if you have the responsibility as a government official, perform your duties without fear, without any favor. And if you feel like your ability to discharge your mandate is being compromised, quit, because you cannot earn salary and earn our taxes and you're not discharging. So from where I sit, I think we must take responsibility, all of us. We as the leaders of the workers, we must push the way we're supposed to push, but the government is supposed to come so that we have a middle ground where we can meet and move the country forward. I can tell you, still on the issue of strikes maybe have not yielded anything. When devolution took place, we had only 8,000 nurses that went to the county governments. And then out of those 8,000, I think we had another 8,000 economic stimulus program. They were called ESPs. Yes. So when we fought for ESPs, we also fought. It didn't just come free. We had a nationwide strike where we are saying ESPs must be converted to permanent and pensionable. And that happened. They all converted. So they moved to 16,000. Today, as we are talking, we have about 31,000 nurses employed at the county government level. Okay. So from where I sit, we have made stride. But the shortage of nurses in this country is 145,000. So when you talk of 30,000, what are we talking about? We are way far away from, even we are not a half of what is needed.
So industrial action is clearly working, but at a slow pace. But we shouldn't get to that point of industrial action.
Very true, very true. So I think then you drive me to the next point of what is on our return to work. In this country, we have given our own laws that the employer has a responsibility to provide a comprehensive medical cover for the employees. Now, we have county government, and I'm shocked, like if you go to Kajiado, they don't have a cover for our people. You go to Migori, they don't have a cover for our people, and several other, amounting to 7 counties. Now, unfortunately, again, there are those that have procured even private insurance companies. And I must talk about it because when our people move around and you have been given money and you're not offering services, a company like a Trident company, they are not doing anything. Our people like in Isiolo, they gave money to Trident company, and you're given money as insurance company. What you ought to do is to move and have a contract with the facilities that are within that locality to offer emergency services and services to the people who you have taken money to do. So they are not doing anything. And that is Isiolo, Marsabit, Meru, and also Kisii has joined the same bandwagon. And we feel that that is bad manners, because in any case, you are making us have trust on something I have on paper, like I have a cover, but when I need that services, I don't have it. Okay. So that's bad manners. But again, we must call also some big insurance, like our people in Nairobi are complaining. We have Jubilee Insurance, where they have been able to procure, but they have gone and separated people into two. They call it Jubilee Insurance Piwa, and they have MTIBA.
Is there a reason for it?
You see, when they do that, when they segregate people, it's because they are limiting services to some, and yet they maximizing benefit instead of maximizing services. Okay. So that's bad. And that's one of the items that we want them to fully implement and a guarantee. Because healthcare workers, we are working within a space where we are prone to infectious condition. And once you're infected, you need to get services whenever you need it. So we cannot be people who offer services that we cannot afford. That's key. And having said about how strike has been happening in our country time to time, 2012, 2017, every year that we have strike, and every government coming in place promising to do something. Remember, when this government came in place, you saw the president launching the Kenya Human Resource, the KHRAC, in State House. And he said, now we have a vehicle that will be able to do what? To address the issues of the human resource in the health sector. And we went to Kericho. Remember the Kericho Declaration? There was a clear roadmap on what to be done, so that we are proactive and address the issues, so that we don't wait until there is a crisis for us now to pretend to be addressing those issues. But after the Kericho, what happened? And that's why in the health sector, when we do our own analysis, we feel that we lack good governance and people who have good manners to man our health sector. And that's why we continue changing laws, changing policies, but we tend not to make some steps.
Okay.
And I must point out, like what is happening with the Social Health Authority, where every day government officers will come to tell us how they have made some stride. But Kenyans are complaining. You know, if you are smart the way you are smart, it is we to tell you are looking smart. If you are putting on tattered clothes and telling us that you are looking good, you are shaming yourself. The government need not to shame themselves. Actually, they need to invest in healthcare workers who are the face of the healthcare system, and they will give them mileage whenever they want. These are the people who need to be on the ground to work.
Right.
When we are not working, and the system is not working for 2 days, and a CEO of a referral hospital come out to say it was only 2 hours. And by that time, that's to mean that patient was not admitted.
Okay.
It is very painful and it is immoral.
How do we achieve a type of care if we don't have health care?
That is what I'm saying, that the president must entrust people who have passion, people who understand what really Kenyan want, who actually must get out of their egotism and serve Kenyan.
Okay, we want to take a break, but of course, when we come back, maybe Panyako, who was once in government, might tell us what the problem is. But first, let's take that break.
Hii January tuna survive na maringos, manjoti, mabike, mapopcorns. All the bets up. Very nice. Very nice.
Skuman January na Odibets. Wekelea kwa Odibets app upate za kupiga January. Odibets. Very nice.
Furahia Chapala Daka Mamili. Daka laki yako na 20 bob peke. Changamka. Win cash every 20 minutes. Multiply pesa yako times 5,000. Kila draw. Shinda bonus prize chungu nzima ndani ya Daka. It's easy. Cheza Daka Babili na 20 bob to 2,000. Pay bill 440-440. Account KTN. Win cash direct to your phone every 20 minutes. Cheza Daka. OneXBet app and enjoy the variety of sports anytime, anywhere. OneXBet app, at the heart of the game. Download OneXBet app and enjoy the variety of sports anytime, anywhere. OneXBet app, at the heart of the game.
We value your feedback and welcome your comments, queries, and complaints regarding our content. You can get in touch with us via SMS on 22151. Call 0719012450 or email feedback@standardmedia.co.ke. Our PO Box number is 30080-00100, Nairobi, or deliver it to our offices at Standard Group Center, Mombasa Road, Nairobi. Dreaming
of shopping online from the biggest stores in the US and Europe. Now, it's easier than ever to get those items delivered to Kenya. Shop your favorite brands on websites like Amazon, eBay, and Zara. Then sit back and relax. We'll deliver right to your doorstep in Kenya. Rapid Courier has partnered with Standard Courier to enable you to shop globally and get your purchases delivered locally, anywhere in Kenya. Our fast and reliable delivery service ensures your items arrive safely, right to your door. Sign up today and start shopping online from the US and Europe. With delivery to Kenya made easy. Shop global, delivered to Kenya. Sign up today on rapidgroup.com and start shopping globally.
Welcome back and thank you for staying with KTN Prime. Of course, we continue the conversation. My guest is still with me here in studio. Far left, we have Seth Panyako, Secretary General of the Kenya National Union of Nurses, and next to me, George Gibore, Secretary General, Kenya Union of Clinical Officers. And before we took that break, we're talking about the issues affecting the Social Health Authority. You are the people on the ground. You know what is happening. We've seen Kenyans complain about the challenges, but the government insists that these are tipping problems. Panyako, to you, are these just tipping problems?
There can be no teething problem when it comes to the health of our people.
Okay.
There should be no trial and error with the health of our people. We had a functional national health insurance fund. What we needed was to transit people with that system. Not even to transit, it was just to improve whatever was lacking. For example, if we wanted to now cover maybe chronic illnesses like cancer and the rest, do you need to transit the system? You just bring cancer and define it there. It was just a way of stealing money. It is corruption that is killing our people. And it is so shameful that the people who are stealing this money are dancing on our graves. Some of them go for the funerals. When you have died because SHA did not work, then they go for that funeral to speak a lot of trash, and they have stolen the money that is supposed to have helped you. How can you explain that we had a system of NHIF that was efficient? I used it several times. I did CT scan and NHIF paid. Today, I pay almost 1,000 times what I used to pay, but I'm not getting those services. Don't even talk about the people, even as the healthcare providers, we are not able to access those services. And so it's extremely frustrating for the poor Kenyans, because I thought, you know, him and I were family in Kenya Kwanza. And we worked on I remember we were in, was it Bomas of Kenya or where was it? Where we went to work on the health policy, the blueprint on what we want to do in the health sector when we formed government. And we had SHA, the way it is designed, is the best because services have been improved. That's a fact. But the problem, implementation is not happening because the thieves are stealing. The thieves are taking all the money. Then they are cheating us, teething problems. Which is the teething problem? Before you rolled out that program, you should have done what we call piloting. And they told us they did piloting in 5 sub-counties. You remember we were in Kisumu when we were launching the one for Kisumu with the president. So if they did piloting, why did they not identify those challenges and resolve them? I still do not believe there are any challenges because the system that NHIF had required only 700 million to upgrade it, to get the new facilities that were being brought in by the new administration. It did not need an overhaul and abandoning it, throwing it away, and spending 104.8 billion with some criminals from some other countries and siphoning our money away. I don't mince my words, because when you steal from the poor people, you are stealing from the dying. Someone goes to hospital, there's no medicine, there's no nothing. Yet, I am paying a lot of money to SHA. Imagine a civil servant who was paying 1,000. Today is paying 8,000 shillings, 10,000, 17,000, 20,000, 27,000. No, but then services don't exist. I thought that when I'm in Nairobi, I will not receive any phone call from home that a villager has gone to hospital and cannot be treated because of the money we are paying. Unfortunately, the problems have been compounded. We have now more problems. My call to the government is that I know the president knows these thieves who are stealing. He knows them. And since these people are stealing, I am urging the government to ask Kenyans that we contribute money so that we pay the thieves once and for all, so that they leave the systems to work. every Kenyan will contribute 1,000 tupatie rais akawia hawa hizi waondoke. Alafu system zetu is function. Because you cannot be killing Kenyan because you are stealing.
Easier said than done though.
I have said they should do that.
Okay.
And I am happy with these mothers who visited Afya House. Kenyans, it's your responsibility. Don't look at health workers, because when you come to that facility and the medicine is not there, maybe theater is not functioning, light, electricity has not been paid, there's no water, there is nothing we can do for you.
Okay.
We'll be there, we'll sit, we'll look at you. So it's our collective responsibility. And I want to thank the media. The media has done a wonderful job in terms of putting this government on toes. Not only this government, all this government that have been there. I remember the other time there was a 5.2 billion scandal in Afya House. And the media was instrumental in ensuring that that thing was exposed. Don't give up, continue. We are happy and proud of the media, Kenyan media.
Okay, a viewer is asking, ideally, how was SHA envisioned?
So let me put some few things into context.
Okay.
Na kwanza niseme mgala muwe na haki umpe. When this government came in, we had actually done some overview and get to look where was the loophole. Why is it that President Uhuru launched the UHC thrice and it has never taken off? And we realized there was a gap, because the focus of UHC is to capitalize on the primary healthcare concept, whereby, and of course there is studies which have demonstrated that every shilling spent in preventive care services saves 9 that will have been used in curative services. Now, the architecture of the new government was purely to focus on preventive services, so that then we can reduce the cost of healthcare in the country. And the president now looked at it and said, we don't have even a primary healthcare bill. We established and gave ourselves a primary healthcare bill. Act now, it's an act now. And we realized after devolution, every fund collected in a facility, health center facility, the county government was taking it back and getting it back to the hospital to buy medicine, to actually refill the reagents in the lab was not there. So close to 60% of the public facility are not functioning, specifically the lower facility level 2 and the level 3, because at the end of the day they have no money to work. Even some of the staff who assist in cleaning could go for 3 months without pay, because every money that you collect is taken by the county government. So they came up with an FIF, for facility improvement fund, so that every money you collect there, you ring-fence it for that facility for purpose of service, continuum of services. Now, this was very good, and no one has ever criticized this. Now, the architecture of now ensuring that we have a framework to fund primary healthcare was also missing in NHF, because NHF was focusing on curative. Even when you want to do what I call screening for cancer, they were never interested with that. They wait for you to be sick and to be told you have cancer, for them probably to, and even in Beleni, they don't care about cancer.
Okay. So
they said, let's have funds that can now be able to look at this, so that even if there is someone is developing cancer, you can be able to detect it early by virtue of having a working system that now feed into the curative services. And then we felt like that was a very good concept. And I must say that this was not warranting a disconstruction, or rather to actually break down the NHF and establish a new social health authority. We will have actually built on the same. And I want to believe that the system we had, if we were to put the 1 or 4 billion that we have bought even the digital health system, we'll be having the better system.
Okay.
What does Kenya think when they go into hospital today? And I want to give myself as an example. On second, I went to the hospital. Was it on second, third? I went to seek my baby to get at least the replacement of the glasses. The hospital that she has been going since she was 3 up to 14, she can't get it. They say, we cannot give you services because we do not have another agreement with this county. And yet the national government issued a circular saying they have extended this thing they call the comprehensive medical cover for civil servant. So I went to the next facility, no services. So I went the next day again, and that is after a week again. I went to another bigger hospital. At least there, they accommodated me. I was registered. I was given, I queued there. I went to the hospital to see the the ophthalmologist. They actually examined my baby and they said, yes, we need to change the lens and this is the status, what and what. When we reached the status of billing, where I need to be now billed and be actually discharged by virtue of giving me the service, the system break down. I was there for 2 hours waiting, calling the Social Health Authority. They tell me it is the ministry which can assist. They gave me the number to the ministry. When I call the ministry, they say the office of the president. What kind of
office of the president?
Yes, that's what I was told. This is the kind of cycle that everyone gets sick about. That you have no one to give you answers whenever you want. And I must point out today when I was in one of the media where a patient called in and said, he has never experienced any problem when he's paying SHA, but he has experienced problem when he's seeking services. And this is the answers we need. And I must tell the president to open his eye. The people he has entrusted with the health reform are not reformists. We need people who really are patriotic and are focusing to ensure that Kenyan can benefit. Indeed, living every Kenyan, this is a statement. Kila Mkenya atawekwa katika Social Health Authority. Na atapata huduma ya afya ile tunaita afya kijijini ama afya nyumbani. Hii afya nyumbani itakuja namna gani kama hata nimeenda kwa hospitali na sipate huduma? Kwa sababu wale ambao wamewekwa huko hawajui ama they do not an iota of, they cannot even have an iota of a picture of what the president was thinking about all this when he was promising Kenyan. They were not there. They are now thinking, trying to hold this and this. Matawi haishikiki. They are only stealing. And I want to echo my brother that they have now become a club of stealing from Kenyan, that we can't see services because ni sisi ndio tutasikia service imekuwa nzuri tuseme president kazi imekuwa mzuri na nini na nini. Waache kutuambia kwa press. Sisi wenyewe ndio tutawaambia ikishafika hapo.
All right. And I think it was today or yesterday during the Western tour, it was mentioned that those who are against SHA are those that have not registered.
Now, let me, before you go to him, tell me what we are saying we are against SHA. We are only saying we want the system to function. So that then, if that's what the president called we are against SHA, he has a long way to go. And I must say I'm afraid that his term may not assist Kenyan to realize the UHC.
Okay, and that was my next question. At this rate, will we get to UHC 2030? Is it Taifa Care nowadays as it was rebranded?
Yes. You know, the serious jokers around that plan, it cannot get anywhere. I have moved around this country and the complaints are the same. SHA isn't working. You cannot be the only person who is correct in the country. You cannot be the only one saying it's working. Unless something is wrong in your head. You cannot be telling people a few clicks of some few sycophants are misleading you. Kenyans are crying, you can see on television. I'm the deputy national chair of a UDA, programs and strategy, though they have never called me for a meeting since they came in office because they think I'm too critical for them. But when you look at the vision we had, when I used to sit with the president in Karen, when he was the deputy president, and we look at health sector, and we see how we wanted to bring the social health insurance fund, and he will tell me, Panyako, unajua ukikuwa hapa Nairobi, hata mama akiwa mgonjwa nyumbani, wewe utasikia tu ameenda hospitali. Na ametibiwa na amerudi nyumbani, ama analetwa Nairobi na ambulance ya hiyo social...
Which is how it should be.
It should be like that. That's how it should work. But now immediately we took government and now we have a government today, we don't know what type of government. They do not have our vision. They don't know why we supported President William Ruto to become the president. We believed in what he was telling us. Now, whatever we believed in him cannot be implemented. So many things have gone wrong, and that's why you're seeing some of us have kept off. We have instead decided to serve the people who have given us the mandate to serve them. And that is why I am serving the nurses. I believe that the president one of these days will remember where we were with him before and recollect and call people like me secretly vile tulikuwa tunakutana naye kitambo.
But where does that leave Kenyans? That's the problem.
When we talk to the president, we will tell him what is on the ground. Because fellows who are around him, like the one who are just parking like in a jungwa, don't know what is happening. Of course, they don't go to those public hospitals. How would they know what is happening there? They won't know anything. Sisi ambao tuko kwa village, ambayo mimi sijachakuliwa na mtu yote kama kiongozi, lakini all the time nikifika nyumbani, villagers are coming. I can even show you how many WhatsApp groups have been added to make contribution for people who have been admitted in hospitals. Yet I'm paying a lot of money to this thing called SHA. A lot of it. I used to pay 1,700 and I was getting good services. I'm paying 27,000. I'm getting nothing.
Okay.
You're topping up for service.
Anyway, Gibera, I'll let you have the last word even as we wind up. But even as you give your last word, there was some resolutions from today's cabinet meeting, and of course there's a directive that all professional bodies currently categorized as state corporations should be declassified and should not be financed through budgetary allocations. I can see here Clinical Officers Authority, there's equally Kenya Medical Practitioners and Dentists Council, Nursing Council of Kenya. Will it impact services, or will it have a trickle-down effect in any way?
I don't think it will have any ramification.
Okay.
And I think this will have happened long time ago, because I have had some of the institutions that have been enlisted there. And I want to believe like the Clinical Officer Authority means the Clinical Officers Council, because we don't have Clinical Officer Authority.
Okay.
I think it is only last year when they were able to get funds from taxpayers' coffers, and we know some of the institutions that have been benefiting, like MPDC, since time memorial, because as he said, they sit in City Hall, in Affy House, they make decisions, everything. They have been collecting money, despite that they get a lot of money. Then that money, where are this money? By the way, sometimes we really need to redefine some of the activity they have. What are they? Curriculum, supervision of professionals, and facility inspections. These are some of the activity that they do. It doesn't warrant some of the millions I have been seeing being channeled to such institution. Okay. And every time we see complaint from Kenyan of facilities that are misbehaving, they come from the same institution that is funded by taxpayers' money. But again, also the money that we pay to those institutions are from Kenyan. And every time an institution establishes an act of parliament and it's collecting money from Kenyan, that's public money. So there's no way that the president is saying that they are not going to be funded. We are still the one who are funding. So that's what I feel, that it has no ramification whatsoever. And this institution need to be prudent to utilize money. Some of them collect over 100 million every year. Okay. So, and to that extent, I don't know whether that's the last, is it my last word?
Yes, your last word. So you can equally have another one.
Okay, if it is my last one, I need to say that as a country, the issues of health are very go to the heart of every Kenyan, because at every time you will find that maybe within a community they have a patient, or rather they need services. So the structures that we need to see is a government that is proactive and have a better planning for every Kenyan. What do I mean? Like now the pronunciation by the President Trump that they want
US out of WHO.
Yes. To move out of the WHO. We know the ramification which is there, that we still have very many partners, support that we normally get from the WHO, and those programs might be, maybe get some, might not get enough funds to continue supporting what we are doing in the country, and the country need to continue have a focus so that we fund our health system. You know, some key program we still depend on partners. Okay. If today partners withdraw from malaria, we may not get even mosquito net for our people. We may not get key drugs like TB's drugs and the HIV drugs, and even some of the test kits. So these are some of the area where we want the government to be proactive and get to see that how do we start now growing a fund that can actually even stand in a situation where there is a certain withdrawal of a partner. No, we ourselves develop our own. It can be even through the same. Because let me give a good example, like when we talk about Singapore. Singapore medical care, the funds that they have, it has grown to the extent that if they fail to subscribe, they can run the healthcare system for more than 5 years without interruption. So we have no, plan on how to sustain our services and ensure that we can guarantee continuum of services even when there is economical fall down or rather destabilization, so that then Kenyan can be guaranteed. We have been seeing a lot of cry, even juzi. Ministry mesema hatuna some of the immunization. Who give us that? We still get it as a partner function.
Okay. Your last words.
The challenge that we have with the issue of saying that these state corporations will no longer get money from the national treasury is that have they now changed the system of one pay point? Because we are saying one pay point, all the money collected by all state agencies must have one pay point. And then you are coming to say you not give other state agencies some money. So where do you expect them to get the money from? So if that one has to be removed, they should be independent and collect their own money. As the nurses of this country, we have been giving the Nursing Council of Kenya enough money to run their own programs. We have no need for the money of the taxpayers. This money of the taxpayers, let it go into improving services, increasing our salaries, and making sure that the return to work formula of nurses of 2017 is factored in this 2025-26 financial year.
Okay.
Because that is the next battle line. We cannot have a government that promises citizens, then it refuses to implement what it promises. We are going to ensure that we fight this union responsibility. I want to tell members is to fight for their rights. And the union is as strong as the membership. So if you are not a member of the union and you don't support the union programs, you cannot achieve anything. Okay. The union is not about Panyako, it's not about your leaders, it's about all the membership. So I want to urge the government, the president, I want to tell you that the new social health system isn't working for Kenyans. And I'll tell you something that will interest you. I sat with Dr. Francis Atwoli when the SHA was put in place. And I discussed with him and I told him, this is what I think SHA should do to Kenyans. And he immediately told me, I think you are the right person to be a board member of that authority, to be a member sit on the board. And he appointed me to sit on the board. And you know, they said this man is too critical for us. They removed me from the board and told Francis, you are going to sit on that board by force. And that's why I sit on that board. So if you refuse people you think are critical, they bring something different in the system, then what is it that you want? You do not want to give services. You want to get money from Kenyans and use it for your own things. Thank you.
All right. Thank you so much, gentlemen, for your nuggets of wisdom and of course for making time to come and join us and just converse some of the issues that we're experiencing in the health sector. Far left, Seth Panyako, Secretary General, Kenya National Union of Nurses, and next to me, George Gibore, Secretary General, Kenya Union of Clinical Officers. I hope I won't see you again in 21 days, and of course I hope that they fulfill their commitments.
That hope should actually be communicated to the government because they are the architects of our strikes.
All right, thank you so much, gentlemen. And that's how we wrap things up here on KTN Prime. I'm Ashley Mazuri. Our sign language interpreter was Marisha Witi. Have a good night.